Hi, this is Jessica DaMassa with WTF Health, and I'm here at Webit in Sofia, Bulgaria. And joining me right now, I have David Champeaux. He is the head of cognitive healthcare solutions for IPsoft. So welcome. You have some really cool stuff that you're working on. So talk to me about Amelia.
Yeah, so Amelia is our cognitive virtual agent. It's the most advanced conversational agent on the market, and we're training her into a variety of roles in healthcare to address the workforce issues in healthcare and augmenting the healthcare workforce, as well as helping patients access and have better engagement with healthcare.
What's really impressive to me about what you guys are doing is the types of things that you're training Amelia to do. So you're not trying to replace some big picture things. You're trying to do like day-to-day tasks, correct?
Yeah, exactly. So we hear a lot in digital health about the moonshots and people trying to diagnose better than doctors and have wonderful new insights about people's health via wearables and proteomics and genomics, and that's fantastic. What we're focusing on is the routine that consumes 50% of the day of a nurse or 20% of the day of a doctor, and all the things that can free up the doctors from their routine so that they can spend more time engaging with patients and doing things with the insights that are being made available to them. Because there's a huge shortage of doctors and nurses coming up. Like I think there's forecast of 33 million clinical staff shortage by 2030, and 400 million people around the world have access to basic primary care. So for that, you need to free people up from their routine interactions so you create more capacity. And that's what we're focusing on for Amelia, training her to join the health workforce as a buddy to the patients, as a new member of the team for the clinical team, to be part of the team and free them up from their routine.
Okay, so give me a specific example of what you'd be able to ask her to do.
So I'll give you 4 different examples. So we've trained Amelia as a healthcare buddy for a patient. Like they have a care plan, but they have some basic questions like, I've forgotten how to use my inhaler if I've got asthma. Can you walk me through that? Or when's my next appointment? These types of things. If I've got a chronic condition, I need to repeat a prescription. So these types of things which are either operational or a bit clinical, but they're more like day to day. You're not diagnosing a symptom or replacing a doctor in terms of diagnosing. It's someone, they know their condition, they know the drill, but they've got some simple everyday questions. Like I need someone to take me to the clinic tomorrow because I don't have any transport on my own, and that's a problem. Who can help me? Is there parking available at the hospital, or where can I park? Basic questions that otherwise they call the switchboard for. And people are saying the NHS deals with 1 million patients every 36 hours, and have hundreds of thousands of calls to their call center. A lot of them are for very basic questions, like I'm interested in smoking cessation. Where can I get a flu jab? These types of things. You can very safely hand them over to someone like Amelia, say, hey, I'm your buddy. I can take you through that, not just answer a specific simple FAQ, but give you some options, help you discover your options, and then help you book into the relevant service. And when she does that, that means it frees up the time of the nurse and the doctors to have more meaningful interactions. Now, on the other side, for the doctors, she can be their own wingman or whisper agent to free them up. Okay. So whilst they're dealing with the patient and they'd like to be able to focus on the patient, instead of putting the patient on hold while they're logging into a system or turning away from the patient to fiddle with the EMR, which everybody's complaining about it, they can say, you know what, Amelia, I'm on the phone with the patient, I'm dealing with the patient, I need to admit the patient. Is a bed available? Or have the test results for my patient come back? Or where's my patient? And these types of things. And it's like, Amelia's like, okay, roger that. But it's not just a simple FAQ again. If you say, I'm going to need a wheelchair for that patient. Okay, well, is the patient left-handed or right-handed? What's their weight, size, etc. Is it a child, adult, etc. So we can order the right wheelchair. So she can have a bit of a conversation. But again, it's not like navigating through 10 fields and clicking things, etc. You're just having a natural conversation as if you had an assistant. Okay. And she's integrated all the systems, following the protocols, ordering things, etc., and freeing up the doctors and nurses, from the admin, and the
So
operation.
tell me about the technology behind this then. How are you training her? Like, I mean, like what's behind this? I mean, obviously it's AI.
Yeah.
Is there a chatbot? I mean, like, talk to me about the tech behind this.
Yeah, so effectively, what we're training is a brain.
Okay.
And as a human brain, there are multiple aspects of the brain. So Amelia actually has 6 brain modules that operate concurrently all the time.
Okay.
So I'll tell you a bit about those and why it's important, because chatbots are very linear, static, and the experience isn't very nice. If you try to if you change your mind in the middle of a conversation with a chatbot, they basically say it doesn't compute. And everybody's had these, non-satisfactory experiences with an IVR basic chatbot, where if you go off piste or if you answer something that they didn't expect, it stops, etc. And it's impossible to scale up beyond very simple FAQs. So Amelia has multiple brains. First, and most importantly, she has a semantic brain, which really understands meaning, intent and context. So in your natural language utterances, she's not just looking for keywords or key phrases. She's basically listening to the entire sentence and understanding what you want, that's your intent, and relevant elements of context, which she may use later on in the process and avoid having to ask you to repeat something that you've already given up front as context. So that's her semantic brain. The other element that's going immediately is she has an emotional brain, which is also seeing how satisfied you are with the conversation. So well, based on the pattern of the words that you're using and the pattern of the conversations, and multiple ways in which she's tracking your satisfaction. Then she has an episodic memory, which is effectively loaded into her brain examples of conversations that either she's had before or people you want her to be trained based on have had before. So if you pick, like in a call center, your best agents and take their conversations and transcripts of their conversations and you load them in Amelia's brain, she basically acquires the experience as these best call center agents. They can use those snippets of conversations as ways to have the conversation herself. A fourth part of her brain is her process memory, and so she dynamically has in mind a number of processes, and she has dynamic process activation. So she can, based on an intent she's recognized, start on a process and talk you through that process, and also integrate with a number of systems. So she can look up systems of record, knowledge system, decision support systems to navigate. But if, as humans often do, you change your mind in the middle, she's midway through a process, booking an appointment for you, and suddenly you ask a random other question. Again, a typical chatbot would say, that doesn't compute. I was expecting you to answer yes or no, and you throw another question at me. Amelia said, that's fine, as a human would do. I'll pause where I was, I'll deal with your other question, and once I've dealt with this, I haven't forgotten where I was, I'll resume where I was. So that's the fourth element of her brain. Then the fifth element of her brain is her analytic memory. And for that, she can predict where the conversation is going and run some analytics that also can say she can proactively volunteer things in the conversation. So you might have called up asking about whether there was parking at the nearby at the hospital you're going to for your next appointment, and she might say, oh, by the way, I think you're overdue a flu jab, or it's recommended for you, given your age and whatever, that you have a flu jab before the winter. Would you be interested in this? So she can proactively use analytics and also protocol to say, hey, I need to inject something in the conversation. And then the sixth element of her brain, which is really the most important, is the experience manager, or the arbitrage function, which looks at all the other functions of the brain and saying, what's the right next thing to do? And that's really important, because if you tell me, as a patient, asks Amelia a question and says, I'd like to know how to use my inhaler or whatever, but you also, the way they say it, evidences signs of distress or dissatisfaction. Now, the semantic understanding says, I understand what you want. My process memory says, and I have a process for that, and I could help. But the empathetic brain says, but they're distressed. So the experience manager says, Amelia, first empathize, and then answer the question.
Okay.
which is a better experience. Typically if you deal with a chatbot, you say, when you complain as a human or whatever, you expect a bit of empathy,
Right.
and then answer a question, not a robotic, I'm going to deal with you, and I've basically glossed over the fact that you're distressed. Or Amelia could say, oh, you know what, because you're so distressed, I'm not even going to attempt answering the question. I'm going to escalate to a human agent, because that's also, there's a threshold that we've crossed, and that's the appropriate thing to do. So it's effectively the experience management that's we as humans always do. When you're talking to someone, there's the right thing to say, but also sometimes the right time to say it, and how people would feel about it, etc.
Right.
So we're socially aware, and we're not just saying things which are basically based on right brain. What is the right thing to say? It's actually, how will it land emotionally? Oh, maybe I should shut up instead. So, and that's what we're trying Amelia to do.
So David, how does somebody access her? I mean, do you just start talking? Where is this brain implanted, so to speak?
Oh, there's a whole range of ways in which she can be accessed, depending on how our clients choose to deploy her.
So
for example, some of our clients have implemented her through Slack. So if she's supporting people who, let's say, they're gamers or they're developers, they use Slack all the time, they can start chatting via Slack.
Okay.
They don't necessarily know, but actually it's Amelia chatting back.
Okay.
You could access her via Google Home, Amazon Echo, etc. But at the end of the day, the brain behind is Amelia. She can be integrated into someone's proprietary web portal, or an app, etc. It doesn't really matter. Some of our clients have transformed her into a squirrel. Squirrel. And some as a purely non-human avatar.
Sure.
So some as a woman, some as a man. It doesn't really matter, how she comes across, or whether it's voice or text.
Okay.
It's whatever the right channel we'll integrate into. The most important thing is, what we believe is, what's the point of hearing if you don't understand? And what's the point of being able to speak if you don't say the right thing? So you hear a lot about wonderful innovations in speech to text and text to speech, etc. What we really focus on is the brain behind that manages the conversation. And then we integrate with whatever is the latest innovation in the speech to text or text to speech interfaces, or whatever channels. People talk about holograms, etc.
Right.
At the end of the day, you could be talking to Amelia as a holographic avatar, and that's fine. We'll integrate with that too. But at the end of the day, is the art of the conversation, and how you can have a conversation that's as human as possible and as helpful as possible, so that she delivers an end-to-end service.
David, thank you so much for talking with us and for sharing your
pleasure.
perspective on what's going on here. It's incredible, and it'll be amazing to see how this is taken up in healthcare.
Absolutely.
Very cool. Thank you so
very
much for joining us. This is Jessica DaMassa with WTF Health. Thanks for joining us.